I want to thank everyone for participating. In addition to our committee members, we welcome Senator McGuire, and on the Zoom will be Assembly Members Levine and Assembly Member Kalra. Let me open with some comments, and then I will ask if Senator Morlock or Senator Bradford would like to make any opening comments, which I hope can be brief, and then we will turn to Senator McGuire and Assembly Member Levine and Kalra in case they want to, but then we will go to our first panel. And I will mention what the panels are in a moment. So I'm Senator Nancy Skinner. I'm chair of the Senate Committee on Public Safety. And as I opened, this is a hearing on the spread of COVID-19 in our state prisons. A spread that is threatening the health and welfare, not only of individuals who are incarcerated and held in our prisons, but also the staff, prison staff, and all Californians. A virus knows no boundaries. Its rapid spread has now infected a minimum of 5,000 incarcerated individuals, with over 1,100 in San Quentin alone, along with hundreds of staff who do not live in prison facilities but go home every day, potentially spreading the virus to family, friends, and our communities. As of today, the data we know from CDCR is 22 inmates have died, as well as 2 members of the staff. We know that California is currently experiencing record numbers of new cases, and we have pulled back on the planned opening of bars, gyms, and more. How much of the increase in cases is related to the uncontrolled spread in our prisons, which we know impacts our communities? Over the course of this month-long crisis, the governor, OES, and the Department of Public Health have held regular noon briefings guiding all of us on the importance of physical distancing, wearing facial coverings, hand washing, and the necessity to do widespread testing. What we have to ask ourselves now is, was the Department of Corrections listening? Was CDCR maintaining or mandating the same public health protocols that the state asked of the rest of us? Our state prisons are the largest congregate settings. The major outbreaks and the number of deaths from nursing homes told us loud and clear that congregate settings are incubators for a wildfire-like spread of this virus. My staff and I have been monitoring the outbreak in CDCR facilities since late March, early April. We've been in written and verbal contact with CDCR officials, the administration, the labor representatives of CDCR staff, and state public health professionals. And in the first 8 weeks or so of the outbreak, CDCR and the administration took numerous steps to limit the spread. They distributed masks, provided hand sanitizer, hand washing stations, stopped visitation and intake from county jails. And in those first few weeks, it appeared that the presence of the virus in the prisons was about the same as it was in communities throughout California. But at some point, things went terribly wrong. There was a growing outbreak initially at Chino, and then at the California Institution of Women, Chuckwalla, Avenal, followed by the horribly botched transfer of inmates from Chino to San Quentin. And as we know, there is now the presence of the virus in every single one of our state prison facilities. The decision to transfer incarcerated people from a prison with one of the worst outbreaks, Chino, to San Quentin, which at the point had no known cases, raises significant questions about CDCR's handling of this crisis.